Hey everyone, it's Gavin with Stronger Physical Therapy and Performance. Today's topic is foot and heel pain, specifically plantar fasciitis. Guys, first off, I know if you're a runner, this is a big deal, and a load intolerance like this can be really detrimental to your regimen. So listen up, I'm gonna go through a really quick assessment so you can kind of tell what you need to attack. We're gonna talk a little bit about the mechanics, and then what's best of all and what you guys are all looking for is how to specifically treat plantar fasciitis, because I know many of you have dealt with it for months and been unsuccessful at that treatment. Sometimes it just takes a little bit of work to get after those specific areas. So guys, plantar fasciitis is a load intolerance. So boil it down to too much, too fast, too soon. Whether you're a runner and you went from running 1 mile to 5 miles, or if you're an elite runner or an elite athlete and you went from 0 to 100, or if you're dealing with a pandemic like we are right now and you went from not working out to going 100% at the gym all the time, any of those things can create that load intolerance, guys. And so with plantar fasciitis, we're talking right on the bottom of that foot. A lot of times that pain starts first thing in the morning. That first step out of bed is miserable. You can kind of walk it off a little bit, but then as the day goes on and you do more and more and more, that pain starts to gear it up. By the end of the day, you're hobbling trying to make it to bed. The problem with plantar fasciitis is the fact that it's a fascia. It's not muscle, it's a connective tissue, and is extremely dense, which means that you don't treat it like other areas of your body. Take, for example, if you strain your hamstring or something like that, we have a lot of nutrition to those areas and good blood flow, and so you can kind of rest, move around, stretch out, and then get right back into kind of a tapered strengthening program. Fascia, on the other hand, is different. It doesn't stretch well, and you really have to work on a very specific loading regimen to get back into that training, and especially stuff like plyometrics where you're jumping, running. You have to be very specific with your treatments. So let's talk quick about a very easy way to assess what you need to target and then how you can go about targeting that. So first off here, guys, easy and quick assessment is kind of the knee to wall. So all I'm gonna have you do is kind of take your thumb up position just like this. Take it, kind of guesstimate, it's gonna be just about 5 inches away from the wall. Get that foot lined up. You're gonna take knee straight to the wall, and can you keep that heel on the ground? If you cannot keep your heel on the ground, that is gonna tell us that a deeper segment of tissue in there in your muscle up in your calf is very tight, which again is gonna be pulling down the chain into that fascia. So that is the soleus underneath. Very easy. If you cannot keep that knee in line and your knee is collapsing inside of your toes, again, try it again. And if that heel is coming off, that's an area that you need to be working on. Another easy assessment to see how well your ankles are working is how well can you do a bodyweight squat or an air squat. Can you squat down to parallel and let those knees come in front of your toes without having to have your butt sitting way back? That's gonna give you another idea of how well your ankles are moving. All right, so here's the part you guys have been waiting for. How do you treat it? Okay, so it takes a multimodal approach to treat this, guys. So you can't just treat one specific muscle, one specific segment. You gotta take a look at that whole segment, that leg, that calf, front side, back side, and then all those tiny little muscles and connective tissues inside of your foot. Okay, so it's gonna take soft tissue work, up the chain, up in your calf here, and weighted stretching, guys. So this is one place that I see a lot of people make a mistake, is our calves are extremely strong, which means, you know, they lift our body thousands and thousands of times. So a simple body weight stretch like this, where you're just placing that back leg behind you and getting a little bit of a stretch, is maybe gonna feel good for a few seconds, but in the long run, it is not going to make a change that you need in that calf. You need to overload that stretch and put some weight on that calf so that you can start to tell your body to make some changes and gain some range of motion. Next up, may or may not heard of this, is what's called eccentric loading. So again, fascia, tendons, those things, they are different kinds of tissue, which means they take different kinds of loads. And so you need to, in a sense, overload your tissue in order to get it to respond. And so eccentric means that you are working on the lowering portion of the motion, okay? So it's concentric when you come up, eccentric on the way down. That eccentric portion is where we're going to overload those muscles, overload that fascia to help tell your body that it needs to make a change, okay? And then you're going to step into more functional movement patterns, because what better way to increase your ankle range of motion than working on something like a squat? Because again, it takes good ankle mobility to get into a nice deep squat. So you're going to start working into those loaded progressions of squats, lunges, step ups, anything that you can work on that functional range of motion of that angle. Lastly, then you can jump into plyometrics, especially if you're wanting to get back to running. Again, you start those low level plyos, and then you could really advance even into some weighting plyos, so that when you are getting into running more advanced exercises, then you're not overloading the system. It's pretty simple, right? Except for it's not. If you're dealing with plantar fasciitis right now or have dealt with it in the past, you know exactly how painful, stubborn, and downright debilitating it can really feel when you can't get out of bed and take a step without pain in your heel first thing in the morning, and then it progresses throughout the day, and then you go to bed in pain, and the only thing that helps your pain is getting off your foot. But you're reliving that experience day in and day out. So I've given you kind of just some simple background information on plantar fasciitis. Remember, it is much more complicated than that, and if you need more information, feel free to reach out. But the last little bit that I'm going to leave you with is a few of my favorite things to work on as far as soft tissue, some weighted stretches, variations, and then some eccentric loading. If you have questions, like I said, reach out to me. Please follow me on social media. Again, it's Gavin at Stronger Physical Therapy and Performance. I hope you enjoy the video, and try these out if you're having any issues with your feet.